Hello, everybody, and welcome to the Health Babes podcast. I am Dr. Krystal Hohn. Thank you so much for tuning in. We're going to talk all about estrogen dominance today. So many drivers, so many things involved, so many symptoms. So let's dive in. Dr. Campbell's not feeling well today, so I'm going to take over. So I hope you enjoy this episode. There's so much information, when it comes to hormones and so many involving factors. So I'm going to do my best to break this down for you, kind of walk you through how I work with estrogen, especially in the practice with patients and the many things involved. We could do so many different episodes on this, so that's another thing, but this is a great start. So why don't we dive in with symptoms of estrogen dominance? And whenever I'm working with patients, especially, symptoms they can tend to drive you nuts, right? You start feeling like, oh my gosh, I'm gaining weight, or I have acne, or I'm losing my hair, things like that. And then we get on the Mr. Google, right? And we start Googling all these symptoms. And so with hormones, the biggest thing to understand, especially, is we have a lot of overlapping hormones, or symptoms with various different hormonal imbalances. So when it comes to really working with hormones, you really have to take a step back, do some thorough testing, and kind of really listen to your body. And there's so many things you can do to support hormones, which we'll talk a little bit about that. But we're going to stick mostly to estrogen dominance today. And some of the typical symptoms that I see with this are acne, right? I see a lot of acne, typically cystic acne, not all the time, but acne that also has a lot of issues with too when you're eating higher histamine foods. Because typically when we're more estrogen dominant, we can see a lot of this acne presentation, not only on the chin area where it's cystic, but I can also see a lot of redness with acne with estrogen dominance, typically, especially if we're eating the higher histamine foods, because we know when we're dealing with estrogen dominance, typically we're having higher histamine type symptoms. And that's a whole other episode that we could get into too. And Dr. Campbell just recently did a histamine episode. So if you haven't listened to that, make sure you go back. But acne and redness, itchiness with the acne is a very big sign that I see with estrogen dominance. Weight gain, especially around the belly area. And this goes for men too. You want to look at that estrogen testosterone ratio. You want to make sure you're not converting or aromatizing a lot of your testosterone if you're a man down these naughty estrogen pathways. And so typically, in men, we're seeing belly weight gain, increased breast size, they're less muscle mass, things like that. And in women, kind of the same presentation, weight around the belly area, but also just weight resistance, like they're unable to lose weight typically is what I see. And then also waking at night. Typically with higher estrogen, we're seeing this with accompanied higher cortisol, right? So we're waking up a lot during the night, things like that. So you just want to pay attention to that. If you are struggling with that, you may want to look into your estrogen levels. Hypothyroidism, we see a lot of sluggish thyroid with estrogen dominance. And with sluggish thyroid, we typically see slower motility, which is also going to affect how our body is getting rid of estrogen. Because we get rid of estrogen, through our urine and through our stools. So typically with sluggish motility, we're seeing a lot of constipation with estrogen dominant. So we're not clearing it efficiently. And then, of course, painful periods. So whenever I see patients with painful periods, I'm looking at a number of different factors, not just with estrogen dominance, but I'm looking at accompanied progesterone levels, because you could be more dominant with, you could be more estrogen dominant with progesterone let's say your estrogen's normal, but your progesterone is lower. So it's making you more dominant, and you can have a lot of those PMS type symptoms. So cramping, increased breast tenderness, a lot of mood swings, histamine symptoms that week leading up to your period in that luteal phase, and even around ovulation when we get that really big surge in estrogen right before we ovulate. Oftentimes, we see a lot of those types of symptoms with histamine with that too, but painful periods is typically something that we see with estrogen dominance. And then of course, bloating. Typically with estrogen dominance, there's a big inflammatory component with it. So, you're wanting to peel back the layers and figure out, okay, what's driving a lot of that inflammation. So these are typical symptoms, acne, hair loss, weight gain, waking up at night, hypothyroidism, painful periods, bloating, among many other things. So if you feel like you're struggling with any of those symptoms, look into your estrogen. I personally like the Dutch test because it's not only looking at your levels, but it's showing us, okay, how are we breaking down that estrogen in the body? Where are we struggling at, and what things do we need to be doing to support the body specifically? Because everybody is so different, and there's so many different supplements and helpful tools you can do to help with estrogen metabolism, but you really do have to figure out, okay, what is the best thing, for my body with the presentation of what my hormones are doing. So keep all of that in mind. Okay, so here are some of the common presentations that I typically see with estrogen. Like, what does it look like? What does estrogen dominance look like? You could typically have just overall higher estrogen. So it's in the red, right? And this is typically where patients know it too, with this typical symptoms that I described earlier. But you can also have estrogen higher compared to progesterone. So whenever I'm working with estrogen dominance, I'm always wanting to look at, okay, what does the progesterone levels look like? Because sometimes really working on ovulation and really focusing on trying to work with increasing progesterone levels really helps balance out these estrogen dominant symptoms, or even helps balance estrogen dominant. So you want to look at that estrogen progesterone ratio. You can also have lower estrogen with even lower progesterone. So typically patients will come to us too and say, doc, I feel like I have all of these estrogen dominant symptoms, but I'll also see really low estrogen, even though they're estrogen dominant. And that's typically because progesterone's lower. So you want to look at a lot of these factors and make sure that you're seeing the big picture when it comes to estrogen dominance. Okay, so let's dive in a little bit with the common causes of estrogen dominance. And I wrote some of these down so that I don't miss these for you guys. And we could do so many episodes on this, but I'm going to hit a couple of the factors that I look into when it comes to this. So some of the common causes are xenoestrogens. And if you don't know what xenoestrogens are, these are how I like to easily describe them, is they're like estrogen mimicking, but they're fake estrogen coming from different toxins within our environment, the products that we use, and our bodies just don't recognize the difference from these xenoestrogens compared to, naturally producing estrogen that our body makes. And so what happens is when we're consuming or using a lot of these xenoestrogens, they can go down and favor these less favorable pathways with estrogen. And so it can make us more dominant. And what I mean by xenoestrogens, let me give you just a couple of examples. The water that we drink, especially like with fluoride, with medications that are in the water, you got to make sure that you're drinking filtered water, because of a lot of the crap that's in the water, just to be honest. I mean, especially in city water, birth control pills being within our water system, medications, a lot of this stuff can be xenoestrogen mimicking causing us to favor, go down these naughty pathways when we're trying to metabolize estrogen, and just start to wreak havoc on our system, among many other, issues that xenoestrogens have, not just the stress that it overall puts on our liver and our body. But so water's a big one. We have beauty products. So things that have fragrance, right? Fragrance, phthalates, parabens. This is big. We need to make sure that we're using products that don't contain a lot of this stuff, because our bodies just cannot handle it. It's a lot of toxin load, and it can really cause us to be more dominant. And then also too, plastics, BPA, things like that in our food storage. You have to be careful with that stuff, because that's also very estrogen mimicking. It's a xenoestrogen. So the way that you're storing food, in plastic containers. And this is a hard one because, with patients especially, not everybody can take everything in their house, right, and throw it away. Right? It's just not cost effective. So what I like to tell patients and even listeners that are listening here, start off with a couple of things. Once you run out of your lotion, replace it with something that doesn't have fragrance in it or parabens and things like that. That's going to be better for you and a little bit more cost effective. Same with, kitchen utensils, like the things we cook with. I personally like cooking with stainless steel or stone. I also like cast iron skillets, but you got to be careful with cast iron too, because of iron. We see a lot of iron overload in the practice, but these are still better options than a lot of the coated pans, Teflon pans, things like that. Plastic, do more like stainless steel, even glass cookware where you're storing your food. So that's a big area. Xenoestrogens are a big reason of where we see a lot of estrogen dominance in the practice. Then we have, of course, low progesterone, like I talked about. We can be more estrogen dominant just simply by having lower progesterone levels. So when I'm working with patients, I'm looking also at, okay, why don't they have strong ovulation or strong progesterone levels? Where are they at in their cycle? Like, are you a menopausal woman? Are you perimenopausal? Are you still cycling? If you're cycling, I'm wanting to figure out, okay, what's driving your low progesterone? Things like that, right? So you want to peel back the layers when you're working with hormones. There's a driver for everything, and there's usually, a lot of accompanied imbalances to fix other things. So I love to put the pieces of the puzzle together, especially when working with testing and with hormones, because it's really like a puzzle. It is. Okay. Another reason where I see higher estrogen is a lack of fiber in the diet. We need to be getting in lots of color, lots of fruit, lots of fiber. This is so important to give us really healthy, strong bowel movements. When we make estrogen, we need to metabolize it, through the liver and then get rid of it in our urine and in our stool. So typically I'm seeing, a lot of constipation in patients who are dealing with estrogen dominance. So you want to make sure that you're getting in lots of fiber. We want to make sure that we are pooping every day, if not, twice a day, 3 times a day. Having regular bowel movements. And that's typically, when I'm working with estrogen and hormones specifically, I'm typically, really starting backwards with patients, assessing diet, looking at, okay, are you pooping every day? How much water are you drinking? How much fiber are you getting in? What does your diet look like, right? These are such important factors when working with any hormonal imbalance. And it's some of the easiest tools that you can implement, but most people don't realize that they have such easy tools that they can utilize, right? Other than, supplements and things that we may need to work with, or other contributing factors that we'll talk about in a second. But some of these basic things that we can be doing on a daily basis and working on can really help our hormones, and oftentimes aren't thought about. They seem too simple to patients, like, oh, I just really got to poop, right? And so it's a big factor when it comes to working on estrogen metabolism. So getting in enough fiber, constipation, sluggish liver, especially with the amount of toxins we're exposed to. I always like to baby and take care of the liver. So we can do gentle castor oil packs, making sure we're getting in complete protein sources, looking at those phases of estrogen metabolism. So I work a lot with the Dutch test, but there's different areas that you can support with this to make sure we're clearing well and good. And so this is very specific, when we're working on sluggish liver or even, working with gentle detox pathways, you want to make sure you're definitely working with a practitioner, because sometimes you got to go really slow with that stuff. And it's very dependent on the person, depending on the overall toxic load, right? So just be aware with that. Don't just run out and get a bunch of liver supplements and things like that. You want to definitely take care of and baby that area. And then, of course, we have some genetic components, especially with estrogen. We're looking a lot at that COMT gene. So a lot of the times patients, are dealing with a more slow COMT gene. Their drain is just a little sluggish when clearing estrogen, or especially in that phase 2 estrogen metabolism. And there's areas that you can really support when it comes to estrogen metabolism. But again, this is specific to the person and what their body needs and what they can handle personally. You have to be careful. But some areas that are really supportive for that COMT gene are really good methylated B vitamins, choline, magnesium, making sure we're getting in amino acids, right, with complete protein sources. So these are some areas too that you can really support the liver with. And this is also why you want to make sure your first step is getting in really good nutrient-dense foods. Nutrient-dense diet is important for hormones, not just estrogen, but a lot of our other sex hormones and thyroid and things like that. So yes, our COMT gene, so there's certain genetic, genes, things like our MTHFR, how well are we methylating, detoxing. So you want to look at various, areas like this when you're working with estrogen. And then of course, I'm a big, big component of diving into gut health. This is so important. It's a very big piece of the puzzle when it comes to estrogen metabolism. When we make estrogen, we break it down in the liver and we get rid of it through our stool. So typically with a lot of estrogen dominance, I'm seeing gut infections. So this could be coming from opportunistic bacteria, H. pylori, parasites, fungal infections like candida, things like that. And oftentimes what's happening is, this bacteria is really stopping us from fully getting rid of the estrogen and clearing it through our stool. And what's happening is we're recycling a lot of that into our system. There's a lot of processes and enzymes and things like that involved in this process. I won't get into all of that, but it's definitely, the big piece of the puzzle that you want to take here with estrogen is you got to dive into gut health. You got to support the liver and work backwards that way. And then, of course, working on our stress, working on a nutrient-dense diet, making sure we're staying away from those xenoestrogens. And then, of course, looking at nutrients, right? Nutrients, because oftentimes when patients are dealing with infections in the gut, we're not absorbing a lot of the nutrition from our foods too, because it's also impacting our digestion and our absorption and stomach acid and all the things like that. So, just keep all of that in mind when you're looking into trying to support your hormones, not just estrogen. So just to reiterate, doing, certain gut testing, there's a lot of different tests out there. We work with the GI map test. It's an amazing test, and it's very specific. I've worked a lot over the years with different companies. And so we personally love, the GI map. And this is testing a lot of these microbes. It's also testing an important marker, beta-glucuronidase, that's important too for phase 2 estrogen metabolism, looking at that glucuronidation in the liver and how we're breaking things down. So there's a lot when I'm working with estrogen dominance, I'm doing a lot of gut testing, but then also working with the Dutch test to see, where else I can support this. So I would definitely start there if you're thinking about doing any functional testing with doctors. They're phenomenal tests, and I absolutely love them. Another thing that's a big driver that we see, accompanied with high estrogen is high cortisol. Stress is not stressed enough. And it's not the easiest thing to take care of or to, remove. We all have it. It's something that we all have to work through and deal with and maneuver and juggle. But we have to put the proper tools in place to really help our hormones. It's one of the best things you can do long term for any hormonal imbalance. So whether you're, putting in place these proper stress management techniques like meditation, limbic system work, really retraining that brain and the limbic system from chronic stress, trauma, things like that. Somatic therapy is excellent for trauma that impact our hormones. Breath work, vagus nerve work. There's so many things we can do to really help the impacts of what stress does to our bodies and to our hormones. But you really have to find what resonates with you and what works with you. But there's a plethora of information out there, a lot of free resources too. But make sure, if you're dealing with estrogen dominance, you've got to put stress management at the forefront. And that's with anything. And then of course I see a lot of low thyroid with estrogen dominance. And typically some of the symptoms with that we start to see is that sluggish motility, right? That's really going to impact estrogen clearing. So usually not all the time do I see it, but for the most part, I'm seeing, sluggish T4 to T3 conversion, and things like that. So you really got to start in the gut, support the liver to really start working on that thyroid. So when I'm working with estrogen dominance, as you can see, I'm looking at a lot of these factors, right? It's never just one simple thing when we're working with a hormonal imbalance. We're wanting to put all those pieces together to best support your body and kind of peel back those layers and figure out, what's causing that within your system so that we can really start to give you the tools to properly take care of these things. So some action steps, that you guys can do for listeners that are listening. If you feel you're dealing with estrogen dominance, testing, definitely I would do some blood work looking at a full thyroid panel, looking at important nutrients, like your B vitamins, looking at homocysteine levels, copper zinc ratios, full iron panel, especially for estrogen, that's important. But also your blood sugar. That's also a very big component when you're dealing with any hormonal imbalance. But doing Dutch testing, I absolutely love it. It's looking at your pathways. It's not just a blood spot check. And we're testing at the specific area or the time that we should be testing these important hormones. That's important. You can't just test these at any time. And then, of course, diving into gut health. You want to dive into that and really figure out, are you dealing with any infections and things like that. So that is definitely, as far as testing that I would go. But, if you are someone that, can't work with a functional medicine practitioner or someone who just can't go that route yet, which I understand, everybody's situation, finances, things are so different. And so some areas that I would just start off for you would be 100% eliminate the processed inflammatory foods. So really get in nutrient dense foods, lots of color, lots of plants, complete protein sources where we're getting our amino acids in, lots of fiber. Make sure that you are pooping every day. And if you're not, you got to peel back those layers and figure out, okay, why am I not going to the bathroom? This is so important for estrogen dominance. So going to the bathroom, making sure that you're drinking lots of water. This is some action steps you can take. Making sure that we're working on stress. Stress is going to impact ovulation, which is going to impact progesterone levels. If we're not working on our stress, it's going to affect a lot of our hormones. And so definitely putting in place those tools is going to be at the forefront of some things that you can do. And then there's other things like gently, safely working on your detox pathways. So moving your body, sweating, right? Making sure that, our skin is one of our biggest organs, right? And we get rid of a lot of the things in detox through our skin. So making sure that we're sweating every day if you're able to. Typically, when patients aren't sweating, I'm seeing issues with detox pathways. So you want to keep trying at that. Really supporting the liver with gentle castor oil packs. Even getting in complete protein sources in a nutrient-dense diet, you're already supporting the liver so greatly doing those things. But incorporating like dry brushing, things like that, Epsom salt baths, if you don't have any issues with that, of course, you want to always check with your doctor when you're implementing or taking any new supplement or therapy safely. So to see if it's best for you. But these are some areas that you can really start to pay attention to and really support for any hormonal imbalance, but specifically too for that estrogen dominance. So I really this is going to be like a part 1 for you guys. We're definitely going to do more when it comes to estrogen dominance and hormones. We have so many plans for the podcast. It's been such a labor of love. We love it. We've had so many amazing guests, have made so many new friends and learning so much. That's what life is all about, especially in healthcare, right? We're constantly learning, constantly evolving. So I do want to do like a part 2, which I will be getting in and diving in more to specific things that I work with on the Dutch test, looking at pathways, some of the different support I work with, the do's and don'ts of some of those supporting things. And so thank you so much for listening. We appreciate all of your support, you guys, really and truly. Thank you so much for all the beautiful reviews. We appreciate and love them so much. Words are my love language. So it's just so helpful in the support that you guys give. So if you find an episode that you do love, make sure you leave a review if you can. It just takes a second. And I hope you guys have a great rest of your day.
Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on DrBeckyCampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Krystal Hohn. Have an amazing day.